When it comes to plus, seeing is believing. This segment shows several case reports that demonstrate the ease of tooth movement and the superior results that are made possible with the plus technique. Let's get started. All cases were treated without the use of headgear, mandibular advancement appliances, arch expansion appliances, molar distalizers, removable appliances, or implants. Case report number 1, Class 2 malocclusion with severe overjet and anterior overbite. Treatment time, 15 months, 9 appointments. This patient presented with a full-step Class 2 Division 1 malocclusion with a deep anterior overbite. The lower arch exhibited mild spacing, with the lower incisors behind the APO line. At the place appliance appointment, .016 high-tensile stainless steel arch wires were engaged in both arches. A bumper sleeve was placed over the wires in buccal segments to preserve space for the bicuspids. Light intermaxillary elastics were initiated with just 1.5 ounces of force for correction of the overjet and overbite. Stage 3 was initiated with a .0125 by .0275 arch wire in the maxillary arch and a .022 arch wire in the mandibular arch. Reflex .014 wires were threaded through the deep tunnels of all brackets in both arches. At the following appointment, a full-size rectangular arch wire was engaged in the mandibular arch. These finish intraoral photographs show the excellent results of treatment with plus. Correction of malocclusion was accomplished using only 1.5-ounce Class 2 elastics. Total treatment was completed in just 15 months over 9 appointments. Case report number 2, Class 2 Division 2 with deep anterior overbite. Treatment time, 13 months, 7 appointments. Our second patient represents a Class 2 Division 2 case with a deep anterior overbite. Appliances were placed on maxillary and mandibular arches using .016 Bowflex high-tensile stainless steel arch wires. The loop placed in the maxillary arch is used during non-extraction treatment to correct moderate to severe crowding. Light Class 2 intermaxillary elastics pull 1.5 ounces on each side. Stage 3 was initiated with .0125 by .0275 rectangular arch wires in both arches. Reflex nickel titanium .012 wire was threaded through the bracket's deep tunnels in both arches to generate all torquing and uprighting forces. Finish intraoral photographs indicate excellent results. Total treatment took 13 months with just 7 appointments. Case report number 3. Class 2 Division 1 malocclusion with a deep bite and 5 mm overjet. Treatment time 15 months, 10 appointments. Our third case presented with a full-step Class 2 Division 1 malocclusion with a deep bite and 5 mm of overjet at the start of treatment. At the place appliance appointment, maxillary and mandibular .016 high-tensile stainless steel arch wires were engaged with strong bite opening or anchor bends. Light Class 2 intermaxillary elastics pulled 1.5 ounces on each side. Stage 3 was initiated with full-size .0125 by .0275 arch wires engaged in the maxillary and mandibular main arch wire slots. All uprighting and torquing forces were generated by .014 nickel titanium arch wires threaded through the tunnels in both arches. Finish intraoral photographs indicate excellent results. Total treatment time was 15 months with 10 appointments. Case report number 4, Class 1 malocclusion with severe crowding in both arches. Treatment time, 15 months, 10 appointments. At the start of treatment, our fourth case exhibited a Class 1 malocclusion with severe crowding in both arches. Appliances were placed and high-tensile .016 Bowflex stainless steel arch wires were engaged in the maxillary and mandibular arches. Very light 1.5-ounce intermaxillary elastics were worn on both sides. 2 appointments, 12 weeks later, all crowding was corrected. Stage 3 began with full-size rectangular .0125 by .0275 arch wires in the main arch wire slots. Reflex .014 nickel titanium arch wires generated all torquing and uprighting forces when threaded through the deep tunnels of the maxillary and mandibular brackets. Final intraoral photographs reveal superb results. Total treatment time was 15 months with 10 appointments. Case report number 5, Class 2 Division 1 malocclusion with severe crowding in both arches. Treatment time, 1 year, 1 month, 8 adjustments. At the start of treatment, this patient exhibited a Class II Division I incisor relationship with an increased overbite on a Class I skeletal base. Because of the severe crowding, 4 first premolars were extracted, together with a supernumerary distal to the upper right lateral incisor. Treatment was completed using a total of 7 arch wires. .016 Bowflex stainless steel arch wires reduced the overbite, while .014 reflex nickel titanium underarches align the instanding incisors. The overjet is reduced with 2-ounce intermaxillary elastics. 5 months into treatment, all crowding has been eliminated and the incisor relationship corrected. .020 Bowflex arch wires are used for final closure of residual extraction spaces in 3 quadrants with intramaxillary E-links. 8 months into treatment, rectangular .0215 by .0275 arch wires are placed in the main arch wire slots. .014 Centilloy upper and .014 copper nickel titanium lower axillary arch wires threaded through the deep tunnels will generate all torquing and uprighting forces. Intraoral photographs at conclusion reveal torquing and uprighting to have been fully expressed during the final 5 months of treatment. Space has been left for augmentation of the undersized upper right lateral incisor. With Tip Edge Plus, Stage 3 is simpler than ever. To find out more, visit www.plusbrackets.com or call 800-348-8856.